So welcome to Preventive Medicine Grand Rounds and to the first day of National Public Health Week. I'd like to thank the Student Council for sponsoring our session today and for the food. And thank you all for coming. Just a quick announcement. So next month will be our last Preventive Medicine Grand Rounds for the year. We'll be having Dr. Andrew Martinez, who's actually did his MPH degree here. He works at with Colorado Corrections Office, and he will be coming and doing a talk on public health and in the corrections system. So it should be an interesting talk. That'll be next month, May 5th at noon. And if you wouldn't mind, there's some sign-in sheets around. If you would please just sign in. If you haven't already done so, sign in on your way out. Thank you very much. And Levi is going to introduce our speakers.
Hi, everybody. Thanks for coming. So we got Denver Head Start here today because the theme of Public Health Day, or the day today for the week, is Healthy from the Start. So we have three presenters. The first is Lori Casillas. She joined us from the Office of Children's Affairs at the City and County of Denver in 2012 as the Director of Head Start Health Services, where she oversees the health and mental health services and initiative serving over 1,500 of Denver's children. With nearly 20 years of experience in nonprofit leadership, communications, advocacy, and policy, Lori has worked as an executive director, health program consultant, and advocacy director. Lori earned a Bachelor's of Arts in English and Psychology from Amherst College and is working towards a master's degree in political science from the University of Colorado. Steve Kudebeh is a 1987 graduate of the Child Health Associate Physician Assistant Program. Since 1988, he has been employed in the general pediatrics at Denver Health, seeing patients at the Gibson Eastside Health Center in 5 neighborhood of Denver. Steve has worked as a Head Start clinical supervisor since January 1990 when the City and County of Denver took over the Head Start program. Steve continued his role as the lead clinician with Denver Great Kids Head Start. And last but not least, April Galligan is a licensed clinical social worker with over 13 years experience working with children and families. She has specialized in family systems and family therapy. Her experiences included mental health consultation with children from infancy to 5 in child care, home-based family and child therapy, and outpatient mental health therapy. April leads the Denver Great Kids Head Start mental health consultation team from Denver Health, which works to ensure all children are socially, emotionally prepared to enter kindergarten. So welcome. We appreciate you coming.
Thank you to Levi and the School of Public Health for inviting us today to talk about Denver Great Kids Head Start, and in particular the health program, the mental health program that serves 1,152 children in Denver. So the Office of Children's Affairs is where Denver Great Kids Head Start is housed, and that office used to be called the Office of the Mayor's Office of Children and Education, and has recently been changed to the Office of Children's Affairs. And our vision is to deliver a city where all children, youth, and their families are prepared to succeed. There are 5 city goals for kids in the Office of Children's Affairs, and one is to increase access to high-quality early childhood education, to increase the number of third-grade students who can read at grade level by the end of 3rd grade, to decrease the number of disconnected youth, and that means kids who aren't working and connect them to services and other job training opportunities, and then increase the number of students who have access to and complete a post-secondary pathway, and finally to decrease the number of children and youth who are overweight or obese in our city. The Office of Children's Affairs itself has several programs that support those goals, and we work to ensure that all children have their basic needs met. We have a snacks and supper program that we work closely with, and a summer food program that we work closely with Parks and Recs, libraries, to provide children food throughout the day. We work to ensure that all children are ready for kindergarten. We do that through this program, Denver Great Kids Head Start, and a 5x5 program. And that 5x5 program enables children in Head Start and children in programs served in the same centers with Head Start students to have access to cultural partners in the city and county of Denver. So they're able to access Parks and Recs, they're able to attend unlimited visits to the Denver Children's Museum, the Museum of Nature and Science, the zoo, and really just to expand their cultural opportunities in the city and those of their family. 2 parents are allowed as well with that entry into those cultural venues. And ensure that all children and youth have the opportunity to succeed academically and professionally. And we work closely in our office with the Denver After School Alliance. We have support. We do work with partners who do college prep and career preparation through funding. So for those of you who live in the city and county of Denver and voted, some of you may remember the 2A initiative, and this supports some of those programs as well. For Denver Great Kids Head Start, we have a separate vision, and that is to prepare Head Start children to enter kindergarten confidently with social, physical, emotional, and cognitive skills and competencies necessary for continuing school success. And the next slide illustrates sort of the setup of Denver Great Kids Head Start. We are governed by the mayor, city council, and some of the leadership people within the city and county of Denver. We also have a policy council, which all Head Starts are required to have. And you could call this sort of like a citizens board, which includes parents, representatives from different backgrounds, health, finance, marketing, like I said, a lot more like a nonprofit board. And then we're, like I said, in the Office of Children's Affairs, and in the blue box, you'll see the delegate agencies. I'll talk a little bit more about who they are and what they do. But this is essentially the setup. And then at the bottom, the supplemental services is what you're hearing about today. These are the wraparound health and wellness services that support kids in Head Start. So for those of you who do not know, many of you may already know this, but Head Start was an initiative of President Johnson's War on Poverty. And since then, it was expanded and modified by later administrations. And it's served 30 million children so far. And now there's a lot more coordination with Early Head Start, which is prenatal to 3 years old, continuing from 3 to 5 years old. And really this is to ensure that there's continuity of efforts and impact on the children that are in Head Start. We're guided by performance standards and best practices. Performance standards really outline very specifically, and it's a very long set of standards that I'm sure Steve has memorized over the years that highlight really what children in Head Start need to be receiving, the structure, the staffing, what things we need to measure throughout the year. And that's those performance standards guide every Head Start program in the country. And then obviously narrowing the gap for school readiness is a core purpose of Head Start. And the other thing I do want to mention is the comprehensive staffing in Head Start. That's probably one of the reasons Head Start is a very costly program. In addition to having highly qualified teachers, lead teachers, there are also people who provide services like Steve and his team, disability coordinators, and people who actually are intervention specialists in the classroom with kids. There are family service coordinators who work with families to connect them to resources. They also help set goals for the family throughout the year and check in with those families. Mental health coordinators and consultants like April's team. We also have education coordinators who are working to evaluate the effectiveness of the teaching in the classrooms. And then we have things like staff who oversee the nutrition programs and ensure alignment with some of the state and national standards around healthy food and nutrition. So it's pretty comprehensive. It's a lot of people around that child supporting them and their families. In Denver Great Kids Head Start, the way our system is set up is we have what we call delegate agencies. And those organizations provide the actual services to the children that we serve. And as I mentioned before, we have a space for 1,153 children throughout the year. We may serve more because some may come in and leave, or and that's usually it, that they're in for 3 months leave, someone else takes over. But these are our delegate agencies: Catholic Charities, Clayton, DPS, Family Star Montessori, Mile High Montessori, and Volunteers of America. And for some of these sites, they also have home-based Head Start services. So they work with families who are raising their children in the home, but for various reasons are unable to send their children to centers. So, for example, Clayton serves families in the far northeast center, and transportation is often an issue, so they're unable to get their kids to child care centers on a regular basis. So they have home visits, and then they have weekly visits or monthly visits in the Head Start sites where they can meet with mental health consultants, developmental specialists, and family service workers. And they're also able to attend parent trainings that those sites have for them. And then in the next slide, you'll see this is a bit of a cloudy map, but this is the service area for Denver Great Kids Head Start. So you'll see in the upper left-hand corner that white space, that's the city and county of Denver as well, but it's served by Rocky Mountain SARE. And Rocky Mountain SARE is another Head Start site. It's the largest Head Start organization in Denver, but they do serve that quadrant of the city, and they're also only a half-time program. But they have the same services that Denver Great Kids Head Start has. And then the rest is Denver Great Kids Head Start, and where those dots are where those different Head Start centers are located. So this is a bit of some demographic information about of the families that Denver Great Kids Head Start serves. So 49% of our families speak English, 45% speak Spanish, less than 4% speak African languages, and 2% speak Middle Eastern or East Asian languages. And a lot of those are located in the Lowry Center. There's a Mile High Montessori site there that serves many of those families. And for households, it's pretty much split between two-parent household and single parents. And then here's some health data that I wanted to share. I'll go over a few others, and Steve will also talk about some of those. But 99% of children in Head Start have health insurance, and between 93 to 95% of children in Head Start are enrolled in Medicaid or CHP+. Let's see. And 99% have a medical home. Many of those, about 70 to 75%, are within the Denver health system. And then 100% of our children are fully immunized. The other thing just to mention is that all but 10% of enrolled children must be at 100% or below the federal poverty level. And for those 10% who are not below the federal poverty level, they have to have disabilities or special needs that are supported with the wraparound services that Denver Great Kids Head Start provides. And another data piece that's missing is, but I think really important, is that the number of homeless families Head Start has been serving has really increased over the last few years. And many of those homeless families are served by delegate agencies like Catholic Charities and VOA, and I think a lot of that has to do with the fact that they provide additional services as organizations like food banks and housing, and really that's how they end up within Head Start, is through going to those centers for additional help. So a couple of things about our goals is that, as Denver Great Kids Head Start, is that we are working to ensure that kids receive high quality education, that they receive high quality health, mental health, and nutrition services, and that parents whose children are attending Head Start are working to improve their own skills, and that they're engaged as their child's first teacher. I'll talk a little bit about how that happens with parents in a moment. But all Denver Great Kids Head Start children with disabilities receive high quality and inclusive learning environments. So all kids are part of classroom, the typical classrooms that you see within Head Start. And we work that to ensure that operations and financials administration are efficient and effective. And I think being part of the city really allows that to happen. So quickly, one of the core pieces and one of the major investments of Head Start is around family engagement and participation. And this is the belief that parents are their children's first teachers. And we work on enabling parents to ensure that they are involved in the academic preparation of their children. They attend trainings, they learn how to study with their kids, how to read with their kids, how to set up a home that is school ready. That they understand the physical health and well-being of their kids, and that they know how to get services if they need them, and that they understand what social emotional development means. And April will talk a little bit more about that, but that it's not just about mental illness, but it's about ensuring that children feel confident with themselves in their relationships with others and their teachers, and that they can actually be a support system to ensure that that happens. And ensure that parents are advocates if their children have special needs or have disabilities, and that they are able to, once they enter kindergarten, advocate for their children in those settings. We have vendor partners. We're an office of a few people, but we have great partners who help provide the actual services and deliver those. And today we have Denver Health and Hospitals Authority. They provide our medical, dental, and mental health services. Sewell Child Development provides the intervention services for children with disabilities and special needs. And Sewell works very closely with the mental health consultants at Denver Health. And we have nutrition consultants. That's the actual name of the organization. They provide training to the delegates on menu planning. They do the monitoring for the food and nutrition programs of the Head Start sites. And then we work with the Center for Speech, Language, and Hearing, and they provide twice a year screenings for hearing to all Head Start children, and work very closely with our medical team. And just quickly, I think you could sort of imagine, looking at the list of vendors, what our comprehensive health services are. And that's vision, hearing, developmental, social, emotional, dental, essentially the EPSDT guidelines. And then we have a referral process. Again, this is required by Head Start. We have to be able, through our medical team, provide referral services to their providers, their medical providers, or to health insurance programs or mental health services if throughout the screening process our team realizes that those children need additional support. Health monitoring throughout the year. We just are making sure that what should be happening is, and our team goes through files and ensures that we're tracking things and that there's follow-up with families happening. Coordination with disability services, that we track the impact so we're able to see, what our numbers look like from the beginning of the year to the end. That we are providing social, emotional, and mental health support, that we connect them to dental and medical homes if they are not yet connected to those. We provide health and nutrition services, and then we also, through a partnership with the university, work on a large cultural wellness and preschool initiatives. And this is to increase health access to healthy foods and active living for children in Head Start sites. And that's a pretty comprehensive program that we're hoping to continue. The funding ends in December, but we'll be looking at additional funding. And one of the things I like to emphasize is the relationship and benefits of having our relationship with Denver Health and really being the safety net provider for families and children. So that's something that I think we can't overstate, is that we have the largest safety net provider in the country at the table doing those services and connecting families. So a couple of things I wanted to mention is that, there's been an increasing effort to measure school readiness impact for children in Head Start, for teachers who are teaching them. And one of those efforts is TS Gold, Teaching Strategies Gold. And this is a statewide effort to ensure that all children in early childhood settings are meeting benchmarks as they move through the the early childhood education experience. And in this case, it would be Head Start, and we're following those same objectives. CLASS is the teacher scoring system. That's really a pretty comprehensive way of measuring the quality of the teachers. Are they providing emotional support? Do they understand content that they're teaching their children? Do they understand how to assess the learning of the child? So there are these are pretty key ways, and there's a lot of effort around this in research and figuring out whether or not we're making a difference in preparing these kids for school. And so that next is April, but I just wanted to open it up for any questions anyone might have about Head Start or the model. Okay, great. So next is April. She will be talking about the mental health services.
Hi. Like, am I too loud? No? Too close to the microphone? Kind of what they said, I'm a licensed clinical social worker, so I provide mental health services for Denver Great Kids Head Start, and like Lori explained, that's over 1,000 kids. I am the lead for a team of 7 LCSWs. So there's 7 of us that provide mental health services for all of those kids, plus all of the teachers and all of the administrators that are involved with with Denver Great Kids Head Start. Okay. All right, so most of the time people say, why do we need mental health services when we're talking about young kids? Do kids really have mental health? And according to the Journal of 0 to 3, which is an excellent resource if you guys are ever looking for birth to 5 information, early childhood mental health is the social and emotional well-being of infants, toddlers, and young children. Social emotional being your capacity to thrive in the world and the relationships that you have with the people that you interact with, and to really have a healthy relationship with peers, with your parents, with caregivers. There is an increasing recognition that the social and emotional development of young children is an important, although often overlooked, domain of development and is an important component of school readiness. So I always point that out because a lot of times people are more interested in, does my child know 1 + 1? Do they know their ABCs? And we know that when children are born, they don't automatically have skills that allow them to build friendships. They don't know how to problem solve. They're not quite sure how to self-soothe. And they don't, most importantly, they don't know what angry is or what sad is or what happy is. And so we as adults have to teach them these things. And in Denver Great Kids Head Start, we have an excellent opportunity to do those things. And so that's how mental health services support school readiness. What do we do? So there's 7 of us, and there's a lot of kids. And you guys saw there were 5 delegates, 6 delegates, sorry. And what we do is we've broken down a model that's based in the best research for mental health consultation, which would indicate that to get the best results, we need to have a collaborative relationship with everybody in the system. And in order to do that, we put together kind of a service agreement where we've asked their administration to look at the services we provide and agree on what they would like us to provide. The Delegate Liaison is the person that will go in and will talk with directors, with managers, with the mental health and disabilities coordinators to make sure that we're doing what they want us to do and that we're not just deciding what it is they need. We talk a lot about universal consultation, and I think a lot of times that's hard for people to think on. What does that mean? What everyone would like us to do is to impact all 1,153 kids. And when there's 7 of you, you can't do traditional mental health work. You can't do the one-on-one family work or the one-on-one play therapy because there's not enough time. So we do things working with teachers, working with families to really try and impact the entire system, not just one kid at a time. So we'll do things like provide formal observations with written feedback that's in the classroom. So let's say they're having a hard time at nap time. We can come in and look and see what's going on, provide some feedback on how to make nap time work better. strategies for improved classroom management, and support for inclusion of social emotional needs into the daily curriculum. So again, how do you teach kids to build friendships? How do you teach kids to self-soothe and to deal with being angry or being sad? We also provide parent education classes. We will do one-on-one kind of psychoed groups with families or with parents, more specifically classroom-based if they have something in a classroom they want us to address. And then we do brief therapy, but at a very limited basis, so it really needs to be appropriate because we're not long-term providers. And a lot of the kids we work with need much more than what we can provide, so it's much more responsible for us to refer to someone who can provide them the resource that they need. And then we also attend monthly collaboration meetings. Lori kind of spoke to this in that we're kind of the provider that needs to work with everybody. So we work with health, we work with disability services, we work with education. And once a month for each classroom, they come together and they do a collaboration meeting where we talk about kids who might have any of those concerns specifically. All of us professionals put our brains together and think on what might help and what the next steps are. And I think that's one of the best parts of Head Start is that we have that ability to do that and to really kind of think individually, but also think holistically of the class and then the system as a whole. And then we also follow up for requests or observations, and that's when someone wants us to work individually with the child. So we, again, will never work one-on-one with a kid unless we have parental permission and make sure that parent has a really clear idea of what it is we're doing. And not just that we're going to fix their kid, but we need them to also be involved, and we need teachers to be involved, and we're going to pull everybody together to try and make everything better for this kid. We also do teacher coaching, and this is probably my success story for the year, but we will encourage the delegates and their administrative staff to think on teachers who might want more coaching in regards to how to work with kids, how to work with kids with behavior challenges, how to work with kids who might have some mental health stuff. So this year, luckily, we were able to ask for 14 teachers to come out of their classroom on a regular basis and meet with us for an hour twice a month, which is huge because teachers don't leave their classrooms. And that was a really, really big success story for us because it means people are starting to really believe that this is important and that we can be a help to the teachers and to the children. And in that, we were able to have 14 recruited. We had 12 follow through throughout the year. One teacher left the agency. There can be some turnover in Head Start. And then one actually got promoted into a administrative position. So that's pretty exciting. And the other thing we do is positive behavior support specialists, positive behavior support plans. So if we have an RFO, we can work individually with the child. We can bring together, again, parents and anyone who's involved with that child to really begin to look at behaviors. Because one of the main challenges that we find is that idea of children's behaviors is that it's kind of something that needs to be managed and controlled. And we really try to shift people's beliefs on that to understand that truly children's behaviors are either they're trying to get something or they're trying to get away from something. And that's a really simplistic kind of viewpoint. But again, if we can look at it and think on what is this kid's, what do they need? Are they trying to get positive attention? If so, how do we give them more of that? If they're trying to get away from too much sensory overload, is the classroom too chaotic? Is there too much stuff on the walls? Do we need to make things simpler for them? So we'll sit down, go through all of this, do some data collection, and really kind of encourage everyone to think about their part and what role they play and how we can support children. We also do trainings with teachers, administration, anyone who really wants us to sit down and talk to them about mental health because, again, most of us feel very passionate about this job and we want people to know everything they want to know. So, for instance, we just did a training on perinatal depression and mood disorders, which kind of is a heavy topic. But again, they all really wanted to know, how do I help a parent who might have postpartum depression or PTSD or, if there was something so awful as psychosis in our classrooms, how do we handle that and what do we do with that? So it was really exciting to be able to give them that information. And last, again, we'll provide play therapy and family therapy, but only with family participation and thinking, what is best for this child. A lot of the kids that we might work with may come from the foster care system. And these are kids who've built relationships with people over and over again only to lose them. And so thinking on a brief therapy model, is it best to build a relationship with a child just 4 months later to say goodbye again, or is it better to hook them up to a therapist who might be able to work with them for a year or longer and really, really work on that trauma that they've experienced over and over again? So these are just some resources if you guys are interested specifically in anything that we might do to help classrooms, parents. CEFL is based here in Colorado, and it's a really great resource. It's connected to the pyramid, and I don't know if you guys have heard of that. It's a social emotional strategy. And we really encourage teachers to use it in the classroom. They use things like visual schedules, looking at that relationship that you have with the child. If you're trying to get someone to do something, how do you give them this positive reinforcement versus telling them no all of the time or to walk away? So there's some really great skills or really great resources on that website. And then there's Taxi as well. And they also have really great resources for parents on ideas of how to help build your social emotional development of your child. So we'll hand that out. That might be things like how to handle temper tantrums, or what do I do to teach my kid problem-solving skills? And it's kind of a step-by-step guide to how to do those things. So I figured I'd just kind of talk briefly, real quick, about some of the main mental health challenges that we might see. I don't know if, how many of you guys have worked with families with young children or within this population, but some of the main stuff that we see is, Lori kind of talked about this, was most of the families that come to Head Start come from a place of poverty, and a lot of them are connected to services already like CCAP and TANF and food stamps. So what this means is that poverty can be a pretty significant concern for mental health and how to support families, not because of the poverty, but because some of the things that can happen with poverty, the stress that's involved in just maintaining a lifestyle and being able to feed your kids and clothe your kids and house your kids. So the families themselves are under a great deal of stress, and therefore the children are as well. We also see parental mental health issues. So we know if a mother is depressed, it's likely her child is depressed as well at this age, because there's so much that is necessary for attachment, and children need to know their parents are safe and that they're fine. Otherwise, they can sometimes start to act like their parents or feel like their parents. My mom's not responsive. I feel depressed. We also see a lot of parental substance abuse, domestic violence, family violence. We'll see a lot of families who have parents that are no longer present through incarceration or deportation, or even fathers, mothers who have just decided they don't want to be involved any longer. One thing I think a lot of people forget is neighborhood violence. Sometimes these families come from pretty significantly violent neighborhoods, and so they are witnessing things that you and I get to hear about at, the evening news, and kind of wonder like, oh, that's awful. Well, these kids are seeing it firsthand sometimes. And so that's really important for us to know, because these behaviors, if they're witnessing this kind of stuff, can look like a behavioral challenge in the classroom, when in truth it's more like a PTSD or an anxiety, depression, and educating people again on this is not a behavior. They're not trying to manipulate you. They're not trying to change things in this classroom. They're just doing what they know how to do because of what they've been exposed to. And then I kind of spoke to the foster care system. So there's a lot of kids that will end up working with us, the consultants, who have already been removed from their homes and who have already experienced a great deal of trauma, abuse, and neglect, and they're acting it out in the classrooms. We're trying to help the teachers manage that. It can be a little stressful. I think I spoke to everything. I had a lot of things to speak on, but do you guys have any questions for me? They are 5 for the most part. It's a 3 to 5 program. That's a great question. I think what we try to do on the mental health end, at least, is if this is a family that really needs some support, we need to make sure we get them community supports. So we do a lot of case management, too, to connect families to services that are out there for these kids. I don't believe that there is a comprehensive bridge from Head Start to kindergarten that would include all of these wraparound services. So it's kind of all of us in our little areas trying to do what we can to keep them connected to community resources.
They're going to get that's more of a senior transition because the transition but the kids who have behavior issues not necessarily.
Yeah, if there's significant enough challenges, they can qualify for an IEP, and they will be legally, they have to have services provided through their school system. Anything else? Okay, well, I'll introduce Steve.
Well, this is a whole lot better facility than when I came into the CHA program in 1984, and we were in a closet about this wide and about that deep. So it was. I'm envious. Let me see if I can. There we go. I've worked with Denver Health and Hospital since 1988. Been working with Head Start since 1990. Had the opportunity to be able to go and do some clinical consultation with the previous grantee, and then when the City and County of Denver took over in 1997-98, I was asked to go ahead and sit in as the clinical consultant supervisor for the health. Most of you probably know about Denver Health and Hospitals. I thought I'd give you the quick overview. We're the largest and the second oldest by 2 months. Johns Hopkins beat us by 2 months, but we're bigger now. Community health system in the country. It started in 1968. We have 8 community health centers, soon to be 9. We're going to be building another one down in the Federal and Louisiana area to accommodate as you notice in that map, we've got a lot of Head Starts down that southwest corner. Yeah, that means there's a lot of poverty down there because that's where we go. We also have dental clinics, at most of the community health centers, not all, and I'll go with dental a little bit more in a few minutes. And 14 community school-based clinics. They are all over the Denver public school system, and they've been really good because they have now got feeder schools that we can actually feed our 3 to 5 year olds into, so that we've got a system now that if a child needs care, the nice thing about the school-based clinics is that they don't charge, and they will take a child who is undocumented, and so that's one of the issues that we have. And we do lots of insurance enrollment. We were talking a little bit about the fact that we have a very high rate of insurance, and we're very proud of that. Part of the reason we're able to do that is because of the relationship with Denver Health, and those families that are undocumented, we're able to bring in to a program that allows them to at least have some sort of coverage. It's not great. There's a lot of big copays, but at least gives them a primary care system. One of some of our kids, then if we need to get them in, we'll try to get them into the school-based system, because as long as I got a DPS number, we can get them in there, and that care for them is free. As these children need specialty care, we've got relationships with our many of our specialty departments, and we can get them in through the system and get them in. If they're a Denver Health a patient, as Lori said, about 75% of the families are ours, and so we're very. This is why this relationship has worked so well between Denver Health and Denver Great Kids Head Start, is because we consider these families to be the ones that they deal with, and that's part of our core mission. We have many masters. The Head Start performance standards. This is the Code of Federal Regulations, Head Start grant regulations. Nice fine print, okay? Now, out of all of this is health and nutrition and mental health. So out of that, we've taken and developed a health manual so that we can be able to help. And this is only half of it. The rest of it is for the health staffs. So, it's amazing how much we have to develop. We also have to follow the Colorado State child care regulations. Every one of our centers are licensed. And that was a commitment we made back in 98, is to get all of our centers licensed. And we've got those regulations. You've got to intertwine the performance standards. We've got CACFP, which is the Colorado Adult and Food Program. We've got Qualistar, which is a rating program for daycare centers. And of course, we have to answer to the parents and figure out what we need to do here. So we have many people who come in and ask us for things. We're constantly being monitored by somebody. As I say, developed a health manual to help us implement all of this. There's policies and procedures in there. There's standard operating procedures. There's guidance for the parents or the teachers on if you've got a child who's ill, what are the parameters for sending them home? If you've got a child who's got a medication that needs to be delegated in the classroom, what do they need to bring in? Who do they need to talk to? Who needs to be trained up? There's a whole training system that we have to make sure that all of our teachers or all the individuals that are going to be delegated. I have a registered nurse on my staff who directly delegates to staff members, being able to do medications. But they've got to be able to perform that duty at the same level as my RN. So there's a lot of training that goes on in Head Start. There's me. There's the resource nurse. She does in the agencies. Out of the 6 delegate agencies, there are 4 of them that have Denver Health personnel that provide services. I'll go over those a little bit more in detail. On 3 of those, the RN goes out monthly and does a mandated, according to Colorado child care regulations, they have to have a monthly visit by an RN. And they go in and they review the medication logs. They make sure that there's no questions. They do training on any issues that the staff may have. And the nice thing is we're also available for in between times. This is what we're here for. So we get a child who's got a severe asthma problem or a severe other health problem. I will often get involved with those, saying, okay, let's make sure that the kids that we have coming in here that the staff is well trained to be able to deal with those children. You get a child who is really a fragile asthmatic. We've got to make sure that the staff knows and recognizes what's going on. We've had some interesting. I feel blessed because I get this revolving 1,150 patient client base that changes every year. So I see that I've seen things in my practice that I would never see before. So, say for instance, we had a child with had come in with a single ventricle, and he had multiple surgeries. So I'd often go out. We'll go out and do training with the staff and make sure, settle them down, make sure that it's okay. They understand what to look for, what to do, and that this kid is probably not going to have a major issue right in front of you, and what to do if he does. We have a dental tracker on my staff who she's an LPN. She also works at Volunteers of America doing the health services. She helps to, every year, we'll talk a little bit about dental here, that every year we have dental providers go out to the Head Start centers and do a basic exam. They'll go out and look and do a fluoride, and they prioritize the children for care. And then then those children are worked with by the nursing staff at the various agencies, and also with our dental tracker to make sure that they get in. If they've got their own private dentist, we use them. If they don't have a dentist, we bring them into Denver Health for their restorative care. I have an LPN at Mile High Montessori and a medical assistant now at Catholic Charities. The rest of the staffing is, Mile High, we always need support from the delegate agencies. So I have an LPN over at Mile High Montessori, but also a staff physician, health assistant at Catholic Charities. We also have a staff health assistant at Denver Public Schools. A little different model. They have 2 full-time RNs who do all of the work over there. Clayton Family Futures has a little bit of a hybrid model. They use a nurse consultant, the PA, who's me, under contract to their early Head Start program, so I can provide seamless services between early Head Start and Head Start. A nutritionist, a health assistant, and a health and nutrition manager. And a Family Star that which only has 37 students for Head Start, is a health consultant and a health manager. Health requirements. We try to engage everybody in this. We work with the mental health staff. We work with the teaching staff. We work with the family service staff to make sure that all of the health requirements are taken care of. And they're fairly extensive. The baseline is they got an up-to-date physical and immunizations. That's Colorado State child care regs. We also do a detailed follow-up on medical, dental, and nutrition histories. We take a history on all of these, and if there's any issues that have come up, we will follow up on those to make sure that the child can be adequately serviced in the classroom. I talked to you a little bit about the dental examination. We have a dentist we have 90 days by the performance standards to get all of the children seen for the dental exam. We don't make it, but we try to get pretty close. We use a dentist from Denver Health, and a dental system comes out. We have a complete portable dental system that we bring in with lights and polishers and everything, and do a fluoride treatment on them and prioritize them. We have a dentist from Children's who goes to Clayton, and they do the same thing. And we use community dentists all the time. We're required to have health screenings on every one of our children within 45 days of their entry to the program. Vision, hearing, height, weights. And then, if there's referrals based on those screenings, we need to get them done, get them evaluated, and get them into the system. If we've got a child who does have a health problem, or an educational problem, we need to make sure that their vision and hearing is good. So we need to make sure that if they pass their vision and hearing screens, if they don't, get them into the system so they can get past. Because if a child can't hear, they can't talk. So we really need to we really work hard on that one. And every child who comes in, we make sure that they're established. Part of our job here is to make sure that the families are well engaged into the process, that they are trained in how to use the healthcare system when they leave, so that it's just not one shot. It's a family training program, if you want to look at it that way, with a component of the child getting their care. So what do we see? We certainly have seen a lot of asthma increase here in the last 15, 20 years. A lot of kids are requiring treatments in the classrooms. If they go out to play, they need a treatment before they go out. And that's where my RN has to do a lot of the delegation and making sure that everyone is comfortable with that. Lots of increases in allergies. We're a nut-free zone at all of our tree nut and peanut nut free zone because of the increase in allergies. You have to be very careful around that. Challenges? Well, the kids that have no documentation, we certainly have to work with them. We need to get the first thing we have to do is build the trust that we have to have with those families, so they will go in to a Denver Health or to some enrollment specialist, so they will trust the system enough, because we can't get them into that program that we have, the Denver Financial Assistance Program, until they go through a screening. And they kind of prove to the system that they are undocumented. Now, that makes them real nervous as far as, now luckily we are not mandated to report to immigration. We really work on making sure that we build their trust on these. Obesity and nutrition issues. We've seen a significant increase in obesity over the last 15 or 20 years, from about 10% to about 22% overall, though I'll talk about a little bit of success story at one place. And access is always an issue. I think with the Affordable Care Act and the increase in the amount of people we're going to be seeing, access is going to be a problem for anybody until we get the balance between how many people we have coming in and the amount of services that we have available to them. It's going to be a balancing act on access. Success, malnutrition. As I mentioned, we have somewhere over 20% of our children are overweight or obese. We did have had a real success story over at Clayton because they've got their health and nutrition management manager is she's almost got her degree in nutrition, and she's really focused on this. They've got a comprehensive program there. They've got a chef on site who does their cooking. They've got they use a community garden. They use lots of fresh fruits and vegetables. They are very careful about as far as processed foods. And I think really what drives us is that really one dedicated person can make a change. We're at about 10% obesity and overweight and obese in that site. So it's a real success story. Another one is our dental program. I was mentioning that dentists back 25 years ago when I started this business, the dentist didn't want to see these kids until they were 3 unless they were trained in pediatrics. The periodontists were the only one who saw them. I know I'm speaking over, feel free to leave. That's fine. And so when, for years we had, baby bottle tooth decay. We had major problems with children, somewhere between 30 and 35% of our kids that, and when we did our first examination had dental caries. We have really focused on dentistry. The pediatrics, the dentists now are taking these children at 1 year old or when the first tooth erupts. We're doing cavity free at 3, so we're doing lots of dental. Me as a PA in pediatrics, I do fluoride on these children every time we see them for a well child check. And we've in the last 2 years we've been at 12 and 14% of kids coming into our program with dental caries. It's been a real success story. Any other questions? Yeah. We've got one pediodontist at Denver Health, but most of the time these are just, basically we don't hire anybody who isn't comfortable with kids anymore. We don't have specifically pediodontist, but they've got to be comfortable with kids, or else we won't hire them. And this took a transition because when they started going into this, wanting to have children, do more children's dentistry and recognize that we're behind the curve once they get to be 3 and their teeth are rotting out. We had to get rid of some dentists. Some dentists left because they said, "Oh, I don't do kids." Well, then you're in the wrong place. Other questions? Yeah. Oh yes, we're down to about 10% overweight and obese at Clayton versus about. Just specifically Clayton. So we're kind of using that as our model, saying here is a model that works. It's an intense model. It takes a lot of time and energy, but it works. Yeah.
They're also a 0 to 5 program, so they work with moms from prenatal to 5, and they integrate all their nutrition and wellness into that 0 to 5 program. Yeah. I would be there. Yeah, we work extensively with WIC. We actually, Clayton has that nutrition that I mentioned there is a WIC nutritionist. We work with them on getting if there's anybody who we have a problem, Melissa McDonald it works for Denver Health. The Denver WIC is very, very amenable. If we've got a problem, we can get them in. Other questions? Yeah. Still talking about Clayton. Is the health and wellness coordinator only there? Is there a reason that only that site has one?
Oh, everyone has one. Everyone has somebody in that role. It's just this person just happens to be passionate about this.
So, no, we have, yeah, and I think it makes us think about, okay, is there other models that we can use for other agencies to help promote this? I think probably our biggest struggle will be Denver Public Schools, because they've got a big organization, and they're pretty set in their ways, and it tends to be our highest obesity rate is in Denver Public Schools. So you look at Denver Public Schools and you look at Clayton and you say, there is a way to do this, but it takes time, energy, commitment, and money. Any other questions? About half the group is, no, 2/3 of the group is gone, but thank you.